Heparin is a high-alert anticoagulant medication, frequently used in clinical settings to prevent new blood clots from forming. It is vital to understand that while heparin effectively stops the growth of clots, it does not dissolve existing ones. Because it acts rapidly on the body's clotting mechanism, IV heparin is the preferred choice for emergency and unstable patients. Common indications for its use include deep vein thrombosis, pulmonary embolism, atrial fibrillation, and the prevention of strokes. Since this medication directly impacts how blood clots, nurses must maintain a high level of vigilance during the entire therapy. Safety is the primary focus for NCLEX exams, covering laboratory monitoring, bleeding precautions, and specific medication management. To track the effectiveness of IV heparin, clinicians rely on the activated partial thromboplastin time, commonly known as APTT or PTT. The PTT test measures the duration it takes for a blood sample to clot under controlled conditions. When a patient receives heparin, the goal is to see a prolonged PTT, indicating the blood is clotting at a slower rate. The therapeutic target for most patients is a PTT value that is roughly 1.5 to 2.5 times the normal range. If the PTT result is too high, the patient is at a significantly increased risk for dangerous internal or external bleeding. Conversely, if the PTT value is too low, the heparin dose may be insufficient to effectively prevent new clot formation. A common point of confusion on the NCLEX involves distinguishing between different laboratory tests for anticoagulants. Always remember this essential rule. PTT is used to monitor heparin therapy, while INR is used for warfarin. The International Normalized Ratio, or INR, is strictly for monitoring warfarin, which is an oral anticoagulant. Warfarin works much more slowly than heparin, which is why patients are often transitioned from IV heparin to oral warfarin. When you encounter an NCLEX question about lab values for a patient on IV heparin, always select PTT or APTT. Because heparin significantly increases the risk of hemorrhage, nurses must perform frequent and thorough patient assessments. Be on the lookout for physical signs of bleeding, such as unexplained bruising or bleeding from the gums. Other critical indicators include frequent nosebleeds, the presence of blood in the urine, or black, tarry stools. Monitor vital signs closely, as a sudden decrease in blood pressure, combined with an increased heart rate, may signal internal bleeding. Nursing safety protocols require avoiding intramuscular injections whenever possible to minimize trauma to the tissues. Use soft bristled toothbrushes to prevent gum trauma and always apply firm, prolonged pressure after any necessary needle sticks. If a patient experiences a serious heparin overdose, the specific antidote required is protamine sulfate. Protamine sulfate acts rapidly to reverse the anticoagulant effects of heparin, making it a critical emergency medication. Remembering antidotes is a staple of NCLEX testing, so keep this information ready for your exam. Use this simple memory trick to recall the antidote. You must protect your patient from bleeding with protamine. Heparin is classified as a high-alert medication, meaning any administration error can have severe consequences for the patient. Nurses should always perform a double check of dosages and infusion pump settings with another qualified colleague. Another important safety point is to never massage the site after a subcutaneous heparin injection. Massaging the injection site can cause local tissue trauma and significantly increase the risk of painful bruising. Understanding these core concepts is essential for providing safe nursing care and achieving success on your exams. Keep in mind that heparin prevents clot formation, while PTT is the gold standard for monitoring its therapeutic levels. Never forget that INR is reserved for warfarin, and protamine sulfate is the specific antidote for heparin. By mastering these key differences and safety protocols, you can approach anticoagulation questions with total confidence. Stay focused on these critical safety rules to ensure you provide the best possible care for your patients.